Hello, welcome to North End Waterfront Health website. I'm John Foster, the Chief Medical Officer here. I've been asked to give a talk on heart health since February is American Heart Month. We've all been so focused on coronavirus that we sometimes are forgetting that all the other medical issues that are out there we still need to take care of. And heart disease is still one of the biggest problems in the United States. I think there are a lot of issues to go over: medical, supplements, diet, exercise, and I'll try to cover all these succinctly in a reasonable amount of time. I think the most important thing to know about heart health is to see a doctor to make sure you don't have risk factors. People are, of course, focused on supplements, diet, and exercise, and we will get to those, but the most important thing is to correct bona fide risk factors that greatly increase your risk of heart disease. And I'll go through these very briefly. The first is smoking. The number one thing that is damaging to the heart is smoking. So that is the number one issue to deal with if you are a smoker and want to improve your long-term heart health. The other things we look at are presence of diabetes, high blood pressure, high cholesterol, and family history. Most of these can be diagnosed easily with a simple primary care office visit, and you should have regular visits to look into these things at regular intervals. Concerning the cholesterol issue, most high cholesterol is actually genetically determined, and often you would know this because there are people in your family, maybe first-degree relatives, your parents, aunts, uncles, and grandparents who had early heart disease, might be heart attacks at age 50 or younger. This is sort of a tip-off that there's something genetically going on in the family that is definitely worth finding out. Diet has a minor effect on cholesterol levels, but is still important in terms of long-term heart health. Likewise, family history is very important. So if you do have a history of early heart attacks, stents, people who've had blockages of their coronary arteries, that is something definitely to bring up with your doctor. So those major risk factors are the most important thing to find out about and deal with in terms of long-term heart health. They've been definitely shown to reduce the risk of heart attack and stroke, and your doctor will know exactly what to do about those, whether it's medication or other testing. Next, go to supplements. Many people are trying to find something they can do over the counter or in their diet that will help promote their heart health over time. Unfortunately, there are no supplements that have been shown to be beneficial for heart health. No vitamins, coenzyme Q10, no protein supplements. Really nothing has been shown to help heart health that's over the counter. Fish oil can be helpful in long-term heart health. However, the doses needed are quite high, and most of the effect is really around improving the cholesterol status. This is something, as previously mentioned, you would want to find out from your physician. So even the role of taking fish oil on your own is questionable and maybe not worth the money. Some people take low-dose aspirin thinking that's been helpful for long-term heart health. A previous study of physicians that is well known showed that just taking a low dose of aspirin every day, all things being equal, lowered the risk of heart disease and stroke. More recently, it's been determined that taking low-dose aspirin has risks of ulcers and bleeding complications and really should be reserved for people that need it. So we've actually taken some patients off aspirin who've been taking it thinking that it was good for them long term. In terms of diet, you've all seen information on what's called the Mediterranean diet, and I think the main thing is limiting red meats or high-fat meats, and also limiting highly processed carbohydrates. If you look online under Mediterranean diet, you'll see certain kinds of advice around that, and that's still an important thing to do in terms of long-term heart health. In conjunction with that, controlling weight is very important. If you are overweight, that is a definite risk for long-term heart disease, and doing something to lower your weight by watching diet and increasing exercise is definitely worth doing. There are also some newer, very safe medications that you may be able to take to help you lose weight under the care of your doctor. In terms of exercise, it really doesn't take much to improve heart health over the long term. Remember, the heart is a muscle, and like any muscles, having some regular exercise for it is worthwhile. About 2 hours of moderate exercise per week, or an hour or an hour and a half of vigorous exercise, is really all you need to have a healthy workout for your heart. This can be a brisk walk for a couple miles a day, several days a week, but it doesn't really have to be anything onerous. Two other things are worth mentioning in terms of supplements and diet. One is salt intake. People have a perception that having salt is bad for your heart health, and in most cases, having excessive salt is a problem. It tends to raise blood pressure, and this may increase your risk of heart disease. There are some people that run a low blood pressure at baseline, and these people, when they stop eating salt, their pressure can actually fall lower and cause fainting feelings. So it's important to understand if you're one of those people where salt really isn't an issue for you. In fact, salt may be a good thing in terms of keeping your blood pressure high enough that you don't feel faint. This is often found in young women and healthy athletes. So universally, avoiding salt is not advised unless you are sure that it's a good thing for you from your doctor. The second thing is alcohol. There's been a lot said about having a glass of wine a day. How bad is alcohol for your heart? In terms of long-term heart health, having excessive alcohol is clearly bad, but having 1 to 2 drinks a day is generally felt to be not very damaging to your heart. And I think more recently, even for men, it's been dropped to 1 drink a day, which is the same guideline for women. Whether it's red wine or some other alcohol is unclear. I wouldn't start drinking if you aren't having a drink every day, but this is not something that is felt to be damaging to your heart if it's in moderation. So these are basically the issues that are important to promote heart health over time. Seeing the doctor to identify any risk factors you might have and treating them, not relying on unproven supplements, but really going with medical information, having a more healthy diet that will promote long-term health, doing some mild exercise, and being compliant with your medications and your physician visits. I think the biggest thing we see as a problem is that people, for example, stop treating high blood pressure because it doesn't have any symptoms and then present with a heart attack several years later off medication. So really taking seriously your risk factors for heart disease is very important. And then finally, the big thing, as I mentioned at the beginning, is really making an effort to quit smoking. Your risk for heart disease and lung cancer go down very quickly, and after about 5 years, you reach a non-smoking risk in terms of further damage for your heart, and after about 10 years, your risk of lung cancer is reduced to normal population. So it really does improve things rather quickly. Hopefully you find this helpful and you can take care of your heart for the long term and avoid any problems. Thank you.